What's up, guys? So today it's going to be a tour of my Notion page of my OB-GYN rotation. Notion is not my house. Notion is not my apartment. Notion is not my PA program. It's simply the best note-taking app for people pursuing medicine or in a healthcare field. For those of you who don't know me, my name is Harsh Patel and I am a clinical year PA student who completed my OB-GYN rotation and now I am in my neurosurgery rotation. I felt like there was an immense issue in terms of me storing the most important information in grad school. There is a powerhouse of information that we as PA students are given in our didactic year, and the most important skill is to know where to store that information because you cannot store all the information in your head. So you need a system. You need an app, you need AI, and you need help. I think Notion is the best app on this market to store that information. And I'm going to give you a tour of it. This is my clinical year page, basically. And so, how Notion works is that the first thing you want to really understand if you are listening to this video on Spotify is that you can really layer your pages. You can create these layers. You can put pages inside pages. And so that is what I have done. So I took one page, I just named it clinical year, and then I started to put all my important stuff like my email templates because we have to do a lot of credentialing before a rotation starts. And so right off the bat, I have some important templates that I could refer back to so that I don't fall off. And for people who struggle with focus, this is a massive hack because it has everything in one place when you are keeping up with the credentialing deadlines for clinical rotations. Other things that I'm going to start putting here is like key documentation. So, one of the things that I had to do for my OB-GYN rotation was to do case presentations on morning rounds. And so I did read a book. Let me get it. So this is the book that I read, and it's called The Physician Assistant's Guide to the Clinical Year OB-GYN edition. And so what I did is this book had a lot of good tips about how to write and present a SOAP note. And so basically how case presentation works is that during morning rounds you pre-round, and then during those rounds you present that case in a SOAP format. Because as a student, you don't have a particular format that you can follow because initially you're going to suck. Giving case presentations, you're going to be so bad and you will feel like you're getting judged inside and out, up and down through your soul when you're doing that first case presentation. But I decided, okay, I'm going to start reading this book and then document everything that I see. So the first thing we're going to look at actually is how I documented this stuff. So this is how that page looks like. And it says how to write and present a SOAP note. And so I've written everything I could under the headings of subjective, objective, assessment, and plan. And then lastly, you can also embed some pictures. And so I have put some fishbone labs so I don't forget what actually those values represent. So I have this page for me to refer back to when I want to freshen up on my skills of case presentation and just what important parts of each SOAP note goes into. Because an assessment section is different than the plan section. And so I need to have that that place where I could store that information, and that is what Notion serves for this. Now let's take a look into the good part. So this is how my rotation specific template looks like. So on the top, I have this big heading. It says what previous PA students wish they knew before rotation. I put it under toggle because I use this to refer back to all the time during my rotation, my 5-week rotation. And so these are some of the like just general concepts that I need to know in my OB-GYN rotation. So you really have to know trimesters, stages of deliveries. AUB is a big one, which we will see. Actually, I'm going to show you important pages of my Notion in my OB-GYN this page, because I think they represent large concepts on the EOR, right? So I have put a toggle list for that. And honestly, this way I could make myself accountable whenever I'm going through that, or whenever I went through that rotation. The next thing I have is the most important pages. So as you can see, so I have a page for review questions for the EOR, which I'll actually touch on in the later part of this video. But I think the most important pages for OB-GYN rotation is your physical exam, because you want to really have a page so that you can refer back to it. It is so important to know what a female specific exam looks like. And so I have a page for that, and it has everything from how to introduce yourself and exactly the steps of following a physical exam. It's so easy to forget about it after didactic. Like, important steps you have to do, not even steps, but also like proper mannerism during your pelvic exam, especially because when you are trying to do that first pelvic exam on a real patient, you want to verbalize what you're actually doing to the woman that you are trying to do a physical exam on. You want to verbalize, I'm going to put a lot of pressure. I'm going to touch here. I'm going to touch there. Let me know if this is painful. You need everything. And so you need to basically be an effective communicator. So I think this page serves as for me being an effective communicator. Next thing is also really important. So I also like to put the EOR breakdown in the first section of the page, because I like coming back to this and looking at all the EOR breakdown. So, for example, the top three gynecology concepts on the EOR are menstruation, infections, and neoplasm. So I'll focus most time on those three. And then I'll focus on the breast and then structural abnormalities. And then the other will be just like, I don't really focus too much time on it. For OB, the two main ones are prenatal care and pregnancy complications. And so I'll spend most of the time on it. And then I'll just review labor and delivery complications, postpartum care here and there. So this page serves as my way to focus on what is important and what is high yield, and actually not for example, if I'm focusing too much time on oral contraceptives like mechanism of action, dosage, then there's something really wrong about that study method, because it's not going to serve me on my EOR, because not a lot of questions actually, only there only be only one question, for example, from the other section. So for me, going into the dosages and mechanism of action of oral contraceptives is not going to help me out. However, it will help me out if I am trying to reinforce some other concepts. So, why is oral contraceptives effective for AUB? Maybe in that way it will help me out. So, this just guides me in order in a way that it just helps me out in a way that where I need to spend the most time in studying. The next thing I like is also having the topic list. And so I'll tell you more about it. Let me just create another page here in a moment. So let me go back to that page. So you can see the topic list right here. Menstruation. Under menstruation, there's amenorrhea, dysfunctional uterine bleeding, dysmenorrhea, menopause. And so if you look at my whole Notion page, just to summarize, it represents just that. You have amenorrhea, AUB, menstruation, dysmenorrhea, menopause, and then I have these these big sections like menstrual disorders, infections, neoplasms, and then I have further broken it down into the specific topic lists on that page. And so I use this to basically create my Notion, whole Notion page. So it honestly looks beautiful to me. Let me know how it looks to you, because I feel like if you set up your Notion like this, there's no way like you're gonna have much easier time studying and organizing information, not only on the page but in your head. So, for example, let's look at AUB, because AUB is going to be a lot of your questions on your EOR. So, if I open AUB, you will see I try to put the most common causes or the most important information on top of the page. Reason being is that when I open the page, I see that first sentence all the time. And so every time I'm opening AUB, I am looking at that sentence. So you know what that means? I don't have to make stupid flashcards to remember that piece of information, because I've seen that so many different times, because it's literally on the top of my page. I cannot miss it. So most common cause, and then it will be N ovulation due to unopposed estrogen without production of progesterone from corpus luteum, right? So that's the most common cause. And then I go into some pathophysiology if I have to, because if I don't understand it, then I'm not going to retain it. So I go to the pathophysiology. And then there are important mnemonics out there. Palm coin is a great one. And then sometimes I use toggles to hide terms and definitions. So let's say I forget the definition of dysmenorrhea. I forget the definition of primary dysmenorrhea and secondary dysmenorrhea. So I put it under a toggle. But now that I am advanced and I have taken my EOR and I have gotten a great score, I, I don't have to look at it. So I hide it. And so that is a great feature inside Notion. And then again, the definitions of AUB. Sometimes I still forget what is the definition of menometrorrhagia compared to metrorrhagia. So I have to review that. And these are some proper definitions. These are wordy definitions, but that's what learning is about. It is, I believe learning is about looking at a complex definition, breaking down those concepts in your own head, trying to explain those concepts to yourself, and then recalling those concepts again and again. And then if you forget about them, you start the process again. And there's no shame in that. And so maybe 6 months down the line, I'm reviewing for the PANS and I forget the difference between menometrorrhagia and menorrhagia. I'm going to come back to this page and review those definitions, put it in my own words, put it in my own head, and keep going with my learning habits. Then I have charts sometimes that really distinguish between different causes of AUB. And then I have the management. And the management is really important for AUB for people who are in their current OB-GYN rotation, because since AUB is a large portion of your EOR, you really have to know their management. And so I have all of that, plus sometimes it's really great to have written words but also charts. This one that I'm pointing to is from Blueprint EOR questions, the rotation specific questions. And again, it will have everything about management, because, for example, if a topic, dysfunctional uterine bleeding, a large chunk of your EOR, then you really have to know your management from A to Z. So that is how my whole Notion page is set up. But I would like to talk about some other things that I have done on top. So I'm going to go back up to top, and I have two things here lastly to mention. So again, you have seen my Notion page that represents the topic list here, PAEA topic list. But also, what you will see is on top of that, I have common complaints and presentations and workup. Now, this area is extremely important to me. Like, I think it's even more important than the PAEA topic list, because every time I see this, it gives me the whole summary of common complaints presentations in OB-GYN and how to work them up. For example, we already looked at AOB, but let's look at actually genital lesions, because that is so important. I put a chart here, and I found this chart so helpful for the differential diagnosis of genital lesions. For example, if you have someone who comes in with this rash on their genitals, right? The first thing you want to do, ask them if it's painful or not painful. So that in that way you can differentiate so much quick. But then there's an added thing you want to consider: do they have inguinal adenopathy, or if it's a painful inguinal adenopathy, or if it's non-painful inguinal adenopathy, or if it's just firm and not painful. So in that way, this chart helps me differentiate everything about genital lesions in just one little section of my Notion page. So I don't have to go into the next text section, which is the infection. I don't have to go into the syphilis page if I don't have to. If I remember everything about syphilis, actually the most important things about syphilis from this chart, that it has no pain on the ulcer, like the patient doesn't feel any pain, but they have firm, painless adenopathy, then I'm good. That gives me the most important summary of the clinical presentation of syphilis. And so I've done that for vaginal discharge, which is really important. And I have further distinguishers like vaginal discharge with vaginitis, or vaginal discharge with cervicitis. And in that way, I'm actually moving through my mental mind map. So if a patient comes in with vaginal discharge, the next thing that I really want to consider, if it's a cervical inflammation or if it's a vaginal inflammation, and that really helps me able to quickly diagnose. And then I will have all the management in these pages further. So I don't have to go through every single thing every single time. I have to make initial decisions based on this differential diagnosis and then make my decision. Lastly, I have is workup here. And this is extremely important for me, because if a question says that a 23-year-old female presents with a breast mass, what is your first initial step? And the answer will be ultrasound. And the reason why is because of this workup right here on your screen. If there's a palpable breast mass, your first initial management under 30 is going to be ultrasound. And if I forget this, I come back to this page. If I come back to this workup section, and I have this for primary amenorrhea and secondary amenorrhea. So I have very important, very specific information on my Notion pages, because think about it. How I think about it is, if it looks detailed to you, then just think about this one concept. I think as providers, one day we will be paid so much money to not have basic information stored in our brain. We need to take that one step forward. We need to take that one step forward in terms of learning an extra piece of information about a particular disease or about a particular workup. This way allows you to keep reviewing that information again and again, because this is what we are paid for. We, as providers, probably, in my opinion, are paid for understanding large pieces of information and making tough clinical decisions about a patient. And so this is a way for me to gather all that information in one place so I can review it over and over again and to make the best clinical decisions in the future. Lastly, I want to show you my review questions from my EOR and how I use this. So I have basically, this page has two main sections because OB-GYN is two concepts: gynecology and obstetrics. So I have these review questions written based on the incorrect answers on my blueprint rotation specific question bank. So for example, blueprint gives you about 250 questions for each rotation. And so you finish that. And I broke it down into 50 questions per sitting. And then whatever I got wrong, I would make that into a question. So for example, I did not know the contraindications of oral contraceptives. So I put it up as a question. What are the main contraindications for oral contraceptives? So one of the main contraindications of oral contraceptives is that you cannot give oral contraceptives to someone who has a history of stroke. Okay? Because that just increases their risk of having another stroke again. So those are some of the things that you want to put as review questions, because review questions are questions that reinforce the things that you already know, but also bridge that knowledge gap in terms of the things you don't know and the things you consistently miss on. And so I've done that for both gynecology and obstetrics. And so this was my Notion tour. And I hope you like this educational, informational video, audio, podcast. And thanks for watching. And I'll catch you in another video having conversations with current PA students, future PAs, and current physician assistants.